on top of the group members and learn to prevent the topic that is control and prevention of MI. First, I would like to talk about the epidemiology of myocardial infection. Cardiovascular diseases are the major cause of MI, which accounts for about 19.6%, that is 32% of the global deaths. In Nepal, MI contributes to a large portion of that annually, with male predominance 6.5 is to 1 to females. And out of all the diseases that due to cardiovascular diseases, 85% was found that due to myocardial infection and strokes. So now I will talk about the risk factors. Etiology of coronary heart disease is multifactorial. That is, it is caused by a large number of agents, like it can be environmental agents, it can be genetic, osteoporosis and thrombosis. So there are two types of risk factors. One is modifiable and another is non-modifiable. So I will talk brief about the modifiable risk factors. Modifiable risk factors are those factors which, if we do some change in our lifestyle, the chances of getting MI can be reduced. First is smoking. Actually, we know, all of us are aware about what harmful effects smoking does to our body. So if someone stops smoking, then the risk of MI can be reduced to a large extent. Next is, I would like to talk about the high serum cholesterol level. Our normal body cholesterol level is generally less than 200 mg per dl, but if it goes higher than 200 mg per dl, it is known as high serum cholesterol level. The causes can be if someone takes like saturated diet. So I recommend that everyone should intake like vegetables and fruits or instead of taking saturated diet, so that the cholesterol level gets reduced. Now the next is about the high blood pressure. The high blood normally the blood pressure is 120 by 80 mmHg, but in high blood pressure the blood pressure can higher to 140 to 95 mmHg. So the causes can be mainly if someone takes like tobacco or alcohol frequently. So if someone stops taking this, the risk can be reduced, the MI risk can be reduced. So now I will talk about the stress. So the students' main stress comes when like exams are knocking in our door or one day before the exam. So I highly recommend everyone that you should not take stress, because it not only causes MI, but it also leads to all other diseases like hypertension and all other risk factors can be. So next I would like to talk about the non-modifiable risk factors. So what are non-modifiable risk factors? Are actually those factors which are not in our hand or which are not in our hand, which we can't control. First is our age. So the age group of MI is